Discussing peripheral vascular disease is Heart Center cardiologist Dr. Simon Gorwara. Dr. Gorwara, what exactly is peripheral vascular disease?
Peripheral vascular disease is the buildup of plaque in arteries outside of the heart. Just like plaque builds up in the heart, in the same manner plaque can build up in any of the other arteries. For example, the arteries of the neck, called the carotid arteries, or the arteries of the arm, the arteries of the legs, and even in the arteries of the kidneys. Depending on where the plaque is building up, we can modify treatment accordingly.
What types of peripheral vascular services do you offer at the Heart Center?
Here at the Heart Center, we have a wide variety of peripheral vascular services, ranging from non-invasive to invasive testing, as well as to interventions and treatment. For starters, we can do ultrasounds of the arteries, we can do peripheral vascular resistance studies, as well as other invasive tests like angiography. We also have the CT scanner that allows us to perform a CAT scan that can look at the arteries.
What is the difference between invasive and non-invasive procedures?
Non-invasive procedures are procedures such as ultrasound, where there is no intervention being performed. The patient does not have any risk from these procedures. Invasive procedures can involve puncturing an artery to get pictures from inside, and there is a small amount of risk involved with that.
How do I know what testing is right for me?
Your doctor will recommend what they think is most appropriate for you. Usually we try and start with the least invasive testing, such as peripheral vascular resistance testing that involves simply putting blood pressure cuffs on the arms and legs and measuring flow. Also, non-invasive testing like ultrasound of the arteries will be performed often as an initial test. CAT scanning of the arteries is another way to look at the arteries in a non-invasive way. If, based on the non-invasive testing, your doctor feels that more invasive testing is recommended, then that would be performed next. Invasive testing may involve a catheter being placed into an artery to perform angiography and take pictures of the arteries. At that time, if it's indicated, a revascularization procedure could also be performed, which may involve an angioplasty with a balloon or a stent to open up a blocked artery.
What treatments are available for peripheral vascular disease?
Fortunately, we have several treatments available for peripheral vascular disease. Just like coronary artery disease, this disease process involves the buildup of plaque in the arteries. So the first thing we want to do is try and slow down that process and prevent complications. This usually involves medications such as aspirin and cholesterol-lowering treatment, as well as control of high blood pressure and control of diabetes. Occasionally, we may feel that more invasive treatment is necessary, such as fixing a blocked artery with an angioplasty procedure or a stent procedure, or occasionally even with a bypass operation.